District-wide free flu shots have already started at the Health Promotion Center in the Cambrian Mall. Ogoma Public Health and Group Health Center have teamed up again this year to offer the free clinics to all residents of the Ogoma district. Through education, they hope to dispel the myths that many people have about getting the flu shot.
So a lot of people come into clinic and they will say, oh, I've had the flu shot before, but I got the flu afterwards, so I don't want to get it. So it's not the flu vaccine that will give you the flu. But perhaps if you got exposed to the flu today, because you're sitting next to me and coughing on me, and I got exposed to the flu that way, it's going to take a few days for me to get sick from the flu. But perhaps today I also came for my flu shot. So then I might get sick from the flu from you coughing on me, but not from the flu vaccine, but you would associate it with the flu vaccine. So it is definitely a myth, but one that a lot of people subscribe to. So we just try to inform people as best as possible that you can't get the flu from the flu vaccine that we give here in Ontario. We give 2 vaccines in Ontario right now as part of our universal influenza immunization program, one called VaxiGrip and one called AgriFlu. And both vaccines contain inactivated flu vaccine, inactivated flu virus, so you can't actually get the flu from having those flu vaccines. And we just try to talk to people and make sure they're informed about that myth.
Although it's suggested that everyone gets the flu shot this year, there are some restrictions.
Depending on what flu vaccine you get, sometimes there's different components of the vaccine that the client might be allergic to. So when clients come into the clinic asking for their flu vaccine, we always do a thorough assessment of their allergies and ask them about specific allergies, things like eggs, chicken protein, antibiotics such as kanamycin or neomycin, which are from the aminoglycoside family, thimerosal, and formaldehyde. So some of these things are only in one of our flu vaccines, some of them are in both. So it's best for if the person's not sure if they can have the flu vaccine, it's best for them to call their doctor or nurse practitioner or call the health unit and ask us some questions first.
One of the best ways to prevent the flu is simply properly washing your hands.
Flu prevention is a big thing. Even if you get the flu shot, no vaccine is 100% effective. No vaccine protects perfectly, so you have to help protect yourself. So biggest thing, wash your hands frequently before you eat, after you go to the bathroom, after having contact with someone. Just wash your hands frequently. The other thing is if you are sick and you're coughing, cough into your sleeve like this rather than on your hands, because if you're coughing on your hands, you might spread it to someone else. And if you are coughing or you've just blown your nose, wash your hands. And another big thing is if you or your child is sick and you're supposed to go to work or school or an activity, please stay home that day. You don't want to go and make other people sick at the same time.
Ogoma Public Health and the Group Health Center are working hard to work through the over 100 people a day now booked to receive their flu shot. Please don't arrive until 10 minutes before your appointment and wear short sleeves to make it possible for nurses to get to your upper arm where the needle is injected.
So our appointment system works quite well, and when people come on time for their scheduled appointments, things run quite smoothly and people don't have to wait very long, and clients are generally satisfied with that. Where we have problems sometimes is if we have clients that come out of sequence from their appointment time, showing up either really early or really late, can kind of throw things off schedule a little bit. Or if people are walking in looking for an appointment, we usually just ask them to call our phone line, and if there's a cancellation available that day, sometimes they can get seen the same day, or usually our wait time for getting into the flu clinics isn't too long, so they're generally okay with waiting a little bit to get their flu shot. We ask that people come to clinic wearing short sleeves or a tank top. You can wear a sweater over top, but something that you could take off so that we can get at your arm with your t-shirt or tank top underneath. It's important that we get at your upper arm in the deltoid region of your arm that we're calling for adults. For young infants under a year of age, we would typically use the legs, the upper outer thigh area, but usually it's not too hard for parents to help us out in that situation.
For more information or to book an appointment, call the flu hotline at 705-541-2332. For Shaw TV, I'm Jonathan Perriard.